So Yunusa Thairu is joining me. He's an associate professor, Department of Medical Microbiology, University of Abuja, Gwagwalada. What that means is that he is the head of the healthcare workers at the isolation center here in Abuja. In fact, let's call it treatment center.
Treatment center.
Yes, treatment center, so that we don't stigmatize.
Yeah.
So welcome to the program. Prof, and good to have you. I must also say, like I said at the beginning of the program, he's the second Nigerian to receive the jab. Not even the president was the first. He's the second Nigerian. I don't know why you are not the first. You are supposed to be the first. Government, politics. But anyway, welcome to the program.
Thank you very much, Nancy. It's good to be here. It's good to join you where the money is, because it's Moneyline.
Yeah, so
but you know that COVID-19 also has some economic impact.
It has a lot of
global economic impact,
yes,
and also local economic impact. Because a lot of people could not get to work. A lot of people could not get their daily pay.
The world was on a lockdown.
On a lockdown. So
due to a health crisis that has caused an economic crisis.
Massively.
So that's why I'm discussing this today. So welcome,
fantastic.
Prof, and thank you for joining us. Second Nigerian to receive the vaccine. You received it on the 5th of March?
Yes, on the 5th of March, precisely on Friday.
On Friday, 5th
yes.
of March.
Yes.
Tell me how you feel. Are you feeling anyhow?
Well, I'm feeling good, and I'm delighted to have had the vaccine, because it's always we always saw it coming. It was coming, and to be part among the first batch of the 4 Nigerians to receive this vaccine is awesome, and also to be the second person to get the jab, I think that is quite good. You know, after so I think it's nice, and it's always good to give a lot of confidence and give a lot of impetus to the healthcare worker that actually face this dreaded disease that has actually brought the world to its knees. You know, so it's good, and I felt later I'm fine, I'm good. As I've said before in one of the programs I attended, I mean, a lot of people tend to ask me, what do you feel? You're not falling down? Your hand is not jabbing, you're not sick, and all those things. I continue doing my normal job as it is, and I've done a lot of job today, which is my normal routine. And I keep on smiling and laughing and smiling. So nothing. I won't smile if there's one pain or something of.
And you're not feeling anyhow in your body, at least for those saying that these vaccines were produced very fast with the speed of light under a year. These vaccines are out to kill Africans. Nigerians should beware, and all of that. That we may begin to have our own immune response may be different to others. What do you say to those people?
Now, I said they need to take a clue from a lot of things, a lot of factors. 3 factors, I would say. The first one is the fact that you put your money where your mouth is, you know, and for the developed world, for those, you know, you find people bringing in money, real money, $3 million, $2 billion from their earnings to just say, give to some pharmaceutical companies, go in and do a lot of research and get out a lot of things. That is awesome. Not looking for the gain from that. Now that is that, you know, we need to get a lot of those kind of support in Africa also. When you find money being given for research purpose, R&D, research and development. Now, the second part of it is the point that we need to also look at it, that the diseases that actually comes in before, when we talk about malaria, we talk about plasmodiasis, it's more in Southeast Asia. You find some of them in Africa. You have it in Africa also, creating a lot of burden. But in Europe and America, they just don't really have the high burden of that. So they will not necessarily actually put money into that. And we need to go and beg them to come and bring money into R&D, research and development of malaria vaccine and all those things. So, but COVID-19 is pandemic. This is something that goes all over the world. And it means that these guys have put money to where the mouth is. And that is that. The third one is for the fact that when we look at it, the burden of the pandemic, you know, is kind of like not as much as compared to what we find in Europe and also in the Americans. But what we always find to be is that our body is constantly in tune with some immunological response. I mean, kind of like, because it was predicted that when COVID comes to Africa, you find a lot of dead bodies, find a lot of people on the street. And somebody once said that he feel pity for what Africa will go through when this disease comes. But we decided, I mean, it did
Yeah,
not
we
happen.
We are
It
not
did not
falling on the
happen. We are
street.
not falling on the street, falling. And then they need to develop this vaccine, and it come. Then we've now procured the vaccine, and then that is going to increase our immune reaction towards that. It simply means that if our body is kind of in tune to what we call immune tolerance, immune availability for immune increase in spikes, it means that if you bring in and introduce a vaccine, the body tends to produce a lot of immune response and towards that spike, which will increase our antibodies against the dreaded COVID-19. And that's why I'm so excited. Being somebody that entered the isolation center every day, virtually we did not go since this pandemic started, and rest. And we are talking about 18 months or thereabout, or 16 months or 15 to 16 months thereabout down the line. We are still pushing on. And it means that you go into the treatment center, virtually every day you enter 2 to 4 to 3, 5 times into different isolation centers, not even one isolation center, and then you come out. It means that your body is kind of like, there's some immune response that your body has actually been in tune to, but now getting the jab will also now increase the antibodies and increase more immunological response, and that make sure will make me feel and work much more better, and will give me much more confidence to go in there and then do the work that I know how to do. That is to make people happy.
Since you received it on your first jab
on the 5th,
5th of March, when are you likely to receive the second jab? Because the vaccines that were received into the country is that of Oxford AstraZeneca, which you will have 2 doses. So is there a date, is there a timeline? When are you going to receive the second jab? Because that second jab is a boost,
yes,
we're told.
Booster, yes.
Yeah.
My second jab will be on the 28th of May.
Oh.
That is precisely about 12 weeks. Around that, estimated about 12 weeks to that. And that has been documented and that's what makes this rollout unique. You know when you have your jab, a green card is given to you, and there's a chip on it, and then you know when next you're going to get your
Oh, it's been called a green card now?
It's green in color. Well,
just like you have yellow card for yellow fever.
Exactly, yellow card for...
Yes, yellow fever.
So we must, because the card of yellow fever looks yellow. This one looks green. So I think I can call it a green card.
Because the world was like, okay, what do we call... What they would definitely call the vaccine passport. So if you're traveling, you must show... Just like you show your yellow card.
Yes.
Okay, so the one they gave to you is green.
It's green in color, and you see all of us taking it and say, I have a jab. And then you give this that you had the vaccine taken. So these are symbols symbolizing the new dawn in the whole landscape of Nigeria. And I know with time, more vaccine coming in, I think a lot of people will be excited, and we need to get this message down to them to take the vaccine. So regarding your question, when next? Yes, we're going to have another one around May, towards May, ending precisely about 12 weeks. And that will serve as a boost to what I had before. And that will be excited to also have that, and then together. No, to answer your question about everybody was kind of like amazed how the rapidity of this vaccine, how it came about. Maybe it may not be good and all those things. Several development has taken place about vaccines. Since 1900, there is when you find the first attempt at vaccination took place by Edward Jenner, whereby it actually now did a research whereby he got John Flep to actually inject him then to see how will it solve what we call smallpox. Then he gave something, and then that something prevented the boy from actually developing smallpox. And that was now given to a large number of people, and they saw that they didn't develop smallpox. Now, that development with vaccine actually have led to what we call a modern day development of vaccine, whereby you may not necessarily use these 3 methods of vaccination that is once used before. That is, either you use the toxoid, which is basically a product of a organism, or you use a live attenuated organism. This means you reduce the potency and the virulence of that organism so that it can actually give that. And then the third one is maybe you killed organism. You kill the organism such that you now remove the other product and then you inject into individual. For instance, polio vaccine, and you have that of life attenuated, and then you also have the kill, which is being given, right? In this case, we now develop what we call virus vector, in which there is a carrier to what you want to get into the body. What that simply means is that if you now have a organism that is not infectious, that doesn't cause problems in an individual, called, for instance, in this case, adenovirus, and then you now take that adeno organism and then you now inject a spike protein to it and inject into me, for instance, if I've gotten the vaccine, that spike protein will be the one that will lead to production of massive antibodies. These are substances in the body we call antibodies in the body that lines the mucosa, the eyes, the nose, the mouth, the nasopharyngeal area, and helps to prevent the virus from coming in. If the virus comes in, it takes it out, and then they form a chemical substance and the body takes it out without an individual even noticing that he actually had that. But that being said, if we have the first jab, you need to also still maintain, even when you had the second jab, to maintain all those what we call non-pharmacological means of prevention by using your face mask appropriately, social distancing, and also using other methods, using your hand sanitizer and washing your hands.
I think we'll come to that in a bit. Since in the last 1 year or so, since we've been fighting this disease in the country, the outbreak, you've been at the forefront. I want you to speak to me about your experience. Tell me how many times you've done tests, for example. How many times have you done the COVID test? Because you are the team lead, COVID-19 Isolation and Treatment Center in Gwagwalada. So you're always seeing the patients every day. You treat them and all of that. Have you contracted the virus in the last 1 year? Is that personal?
That last question has been asked severally, everywhere. But I'm bold to say, because one of those things I do is advocacy, to actually let people know what is really going on, and so that people can have faith and believe in that without allowing a vacuum that can be filled with misconception. Exactly. Now, in this, I've done the test 68 times. 68
times?
Yes.
In the last 1 year?
In the last more than 1 year. We just almost about 15 months, that we know that this is coming, and then we started kind of like, are we positive, are you there, are you a carrier, and all those things, based on the knowledge that we have, as an immunovirologist. Now, have I been infected? Have I contacted it?
Yes, have you contracted it? Yes. You've not contracted, Prof?
I've not tested positive.
With all the treatment and coming in contact with people that have it on a daily basis?
Fantastic, yes. And I always like to give this reason to give the why we actually have that. I'm not surprised. And I know my colleagues and folks, in this field will not be surprised. Let me break it down like a layman. Let's say, for instance, an organism A, comes into the body. There are two effects. It can actually come into the body and not cause a lot of clinical signs and symptoms. What I mean by that is that somebody falling sick and then sleeping, cannot go to, and they say, you are sick, go to the hospital. That is one effect. The second effect it can either be is that you just feel, I'm not just feeling, my head is something, but you can still move about, and then you can still go. At the end of the day, you take a lot of water, you do a lot of things, you find that you are fine. That is what we call subclinical. Now, in either way, the body is producing a lot of what we call antibody in response to what? To the organism A. What are those things the body produces after the body has taken care of that? The body produces what we call anti-A. Anti-A. Yeah. No, anti-A, which is antibodies.
Yes, antibodies.
Antibodies, specifically to A. And it means that subsequently when A comes into the body takes care of it immediately. So what really happened is that for folks like me and others that actually work in the treatment center that, that were lucky, I would say, is that we actually had maybe some clinical dose of this virus. Subclinical dose that you just have it, maybe it does not really bring us down.
So would you say at that point, whether in the last 12 or 13 months or so that you've been fighting or treating people with this disease, perhaps you've been asymptomatic and it hasn't shown, or it did not show, but you say you've done tests like 68 times.
Yes, because the test is a PCR test. The PCR test will tell you there is the infection. But if you look at it, sometimes we spend 3 weeks without tests, or maybe 2 weeks. We do it 2 weeks, or sometimes we just spread it 3 weeks and all those, you know. When you spread it within 3 weeks, maybe within the 1 week or 2 weeks interval after your last test, the body may have come in contact with it, and then maybe you get it off, you are off it. The next 3rd week you do the test, you still see negative. You say, oh, thank God. And then you go back again and continue
So
doing
did you
your
feel
work.
did you feel any symptoms within this period in the last 1 year? Did you feel like you were sick or whatever in the last 1 year?
Surprisingly enough, I think I've been, I know my folks
I know
will actually bear witness to me that I've been working actually. I've been active, in fact, my most respected CMD, my Professor always say that the energy you have, I don't know where you are getting this energy and all those, you know. That is the Chief Medical Director of University of Abuja, teacher, my overall boss, you know. You know, you always say the energy you have and the rest. So sometimes I always look myself, sometimes I sleep late to make updates. I sometimes get to work, I know.
Because you furnish the PTF on
I furnish
the
state and all of, so that they can take the statistics. So, but at the end of the somehow you look at yourself and say, wow, maybe I'm lucky, or maybe because of my body beauty, or sometimes I tell myself that with this my body that I'm not, maybe what we corona eat in my body that I've been looking for in my body. There is nothing for corona to eat in my body. But the real truth about it is that sometimes, not only me, there are other folks also in the treatment center, you know,
that have
nurses,
the same experience
exactly,
like you.
Nurses, doctors, hygienists, and the nutrition, the scientists, the pharmacists, that didn't come down with COVID.
Is it that all of you were observing the non-pharmaceutical procedures? You were taking it so much to heart. You wash your hands, you sanitize, you wear your, of course, if you want to enter into the isolation center, I guess you will wear all your, PPE, all of that. So did that also contribute?
I think we can divide that into 2.
Okay.
For my experience in the treatment center and my heroes, I call them generals, you know, generals, comrade in the war front, you know, they are we fly together. I'm here today talking, but I'm representing a lot of them, the total healthcare worker that are fighting COVID, you know, nationwide, including my own people at University of Abuja Teaching Hospital, Gwagwalada. They are heroes, you know. Now, a lot of them are behavioral. There are 2 things that we do. The first one is for us to do what we call peer review in check and balances within ourselves. If you go to our own treatment center, I can actually talk more about that, University of Abuja Teaching Hospital Treatment Center. You see, there is the general overseer of the center, in that, which is our chief medical director, you know. You also have the house manager, you have myself as a team lead, you have the welfare officer. We have several people that are there, meaning if you are coming in and you are not observing any of those things, somebody is watching you. And we watch each other. The hygienist can actually tell me as a team lead, let's say for instance, I'm coming into the treatment center, maybe I just put the water on my, and just try to wash, and I'm talking. You say, sir, please, can you observe the proper, oh, I'll say, thank you very much, thumbs up, my brother, and we do that. And we record it as an incident, kind of like, irrespective of whose us is God. And that is one. We tend to check on each other. For instance, when you are dressed, and then you are not dressed properly, you see us raising our hand, giving signs to each other. It means that you are, if you are inside and something happens and then maybe you have a break, we just say man down, meaning you need to know that, oh, something is happening to you.
That's a war language.
You know, you don't actually argue. You leave what you are doing, the next person continues, and you are out. And when you are out, you come back. When you come out, you thank the person that, oh, thank you, my guy, for saving my life. You go out. That is one of them. The second one is the ability for us to test ourselves. We have that ability for us to say, okay, let's go for some routine test ourselves. If anybody is down, then the person is properly taken care of, and it's well taken care of. When I mean well taken care of, well taken care of, and that actually gives a lot of confidence and a lot of impetus to the other frontliners that are there. So these are the 2 things that I think must have contributed to that. And that simply means the first question actually answer that issue of us using 0.05 disinfectant. which is one of the most disinfectant that we have, and against COVID-19, which we use in our center. If you take a look through our treatment center, once you are coming in, you have to just observe hand hygiene using 0.05. You spray, you put on your regalia.
Is that different from the one the rest of us use? Talking about hand sanitizers, because during even at the outset of this pandemic, we were told to use the a sanitizer that has at least 70% alcohol.
Yes.
So is that different from what, or is it the same?
Yeah, it's different actually.
Okay.
What we use is based from 3.5% volume water of hypochlorite.
Okay.
Yes,
okay.
jig, hypona, and all those ones.
Okay.
So these ones are the ones but we have a way of preparing it into World Health Organization standard. Yes, and with NCDC also giving us what we call guidelines, and doing a fantastic job, and giving us guidelines. And once we prepare that, you spray yourself, and when you go in, when you are coming out, we spray. We practically also do the bath and bathe with that disinfectant, and then we can now come out, take a deep breath, and then we encourage ourselves up and see and tell ourselves that we're in a war front, and we need to coordinate ourselves. And when we are coordinated, a lot of things actually falls in place, and that is what has assisted us so well.
In the last 1 year till now, how would you say we have actually fought this virus? Because in January of this year, we all saw a spike in the cases. We also saw, of course, the introduction of coming into Nigeria, new variants. Yeah. We have the UK variants, we have the South African variants, we have Brazil variants. How many variants do we have right now in Nigeria, and how do they manifest? And how has it been, at least in the last, it's not few months again, it's in the last 1 year of fighting this virus in terms of treatment of people. Of course, we've lost a lot of people. I personally lost dear friends due to this virus. So how has it been?
To answer
I've
the
asked
question,
you 3 questions.
Yes.
I see you are with your pen and your paper.
Yes,
Professor.
kind of trying to note some of them. So I think what we'll do is, we may the soul of those departed ones rest in peace. We never anticipated, we never wanted that to happen. The healthcare worker fought battles. Sometimes it's saddening, sometimes when you see you're losing patient, but unfortunately it has happened. But we just pray for their soul. Rest in peace. Now, to answer the question, I think I can actually divide the response into the bad, the good, and the ugly. The good, I would say that for the first time you find a coordinated effort by everybody coming on board to assist and see this COVID-19 is defeated, SARS-CoV-2. What I mean by that is that you find all those multinationals, the big organized, the blue chips, the COVID, the media, yourself, everybody coming in, putting on resources, putting on, a lot of things, effort to come in and bring in whatever word they can put in. Some brought vehicles, some brought things, money and all those goods, food and all those stuff to assist the frontliners and also to assist the society to make sure that, the effect is cushioned. I think this is one good aspect. If we can actually challenge all those things and channel all those things to other diseases, I think we can defeat anything that comes our way in this country. And one of those good things is the determination of the healthcare worker. When an healthcare worker comes in, what you usually hear is that the nurse is a nurse, the doctor is a nurse. When we came into the treatment center and vis-a-vis what happened in other treatment center, everybody coming together, nobody knows who is a doctor, who is a nurse, who is an hygienist. Everybody has to be assisting. You have to be your brother's keeper. And we are in there as brothers, not in there as a nurse, as a doctor, or as a hygienist, or as a lab scientist, or as any other person. This coordinated effort should be continued as a way forward in solving the health care problem in Nigeria, whereby nobody is bigger than, everybody comes in at the same pedestal, and everybody also respects its own rule at attempting and helping the patient to get to, to safety and to get well. That is that. The bad of it is, of course, we know that we don't want to lose life. One of those greatest things about a doctor is when you go in there and then you see your patient dies, and then you just feel psychologically that you will have done better or what, but that is that. And the ugly part of it is the social space, the social media came in and occupied the space with a lot of social media stuff, you know, and that has been extended to vaccine now, whereby you find a space being occupied by, if you take vaccine, you're going to die, you're going to fall, somebody took vaccine, slump, somebody, you see, some reportage are not good because they are unfounded and they are not that. So that is one ugly aspect that I've actually seen that actually marked that. That is that. But when we look at it and said, have we really fared well? It's a big question, actually, we'll tell ourselves. But something has to be clear that we need to say that for the first time, when we talk about infectious disease, this is what is local to us. This is one of the biggest problems that we have, you know, as a country, as a continent, you know, and a subcontinent, West Africa. One thing is that we need the ability to have diagnostic tools, infrastructure, and equipment. We have, for the first time, having PCR being distributed all over this. There is no state in Nigeria that doesn't have a PCR machine now.
Okay.
You know, in fact, most states have more than 2, 3 to make diagnosis.
Okay.
And now we have built infection disease center all over the country. Unlike before, we don't have that. You know, virtually you have only Yaba in Lagos, and then you have 1 or 2. But now, practically every state have an infectious disease center, which basically means is something that is quite sharing that can help us to fight other infectious diseases, tuberculosis, malaria, all those things that comes later. That is not pandemic.
Okay.
That is not global, that is local to us.
Okay.
It's really quite difficult for us to actually come in and say these are the various strains that are in Nigeria now. Research is going on. The Nigeria Center for Disease Control is actively working, and the DG is actually actively working so that we can ascertain that. But we know for sure that from what we saw in terms of the clinical picture of patients and also seeing the pattern of what we have, I think we know that surely there are newer strains in the country, because this is not the sign and symptoms of what we see during the first wave. You know, there are differences. You know, we saw those things, and then that remarkably actually changed the way we actually managed the newer variant. But you know, until we now find a laboratory evidence, by the time the sequencing takes place, and then we're able to now come out and say, okay, this is the strain that we have, in comparison, and then after comparing them, we can now say either it's the Brazilian strain, or maybe it's the South African strain, or it's the Cuban strain, or one of them, you know, the UK strain. But I think those are the capacity, the next level that we need to now actually get into, you know, which I think their report is not yet out, but I know that there are newer strains, but to say specifically which of the strain actually will be very, very difficult for us to say now. Yes.
So how safe is it to take the vaccine for Nigerians? Because even after the president took his vaccine, we've seen ministers come to take vaccines, and even, you know, other VIPs take vaccines. How safe is it to take the vaccines, just like you've taken?
Yeah. I will answer in a straight word to say that the vaccine is safe.
Okay.
And we should encourage and tell people that it's good to take the vaccine. Okay. It's good to take COVID-19 vaccine, and it offers protection against COVID-19. And one of the newer amendments against COVID-19, we've talked about using hand sanitizer, we talked about using face masks, we've talked about using social distancing, and also for us to be careful and also to maintain a very new norm of socializing. Now, this as vaccine has actually come in to add to what we had before on ground. But that does not mean that we have to stop all what we have been doing before. It's an addition, not to say we jettison others and then to maintain that. So the vaccine is safe. For me, I have received the vaccine, and
are you okay?
Yes, and I monitor myself daily. I check my temperature using the thermometer. I check every, 3 times in a day to check what it is like. Now, I've not had any increase in temperature. You know, my temperature remains as it is.
So no side effects.
And there's no side effect.
For you.
know, no side effect for me. And I probably, I've discussed with one of my colleagues. In fact, we talked every time with all of us that we had within the first batch of Nigerians that took the vaccine. And none of us has actually developed any untoward effect or any side effect. So that enough we can say that is safe, although we know we are still in the earlier stage of collection of the vaccine. But any side effect or any reaction that will take place will have taken place up to now.
Okay.
But we are still sitting, we are still standing, we are still smiling, and then going about our normal duties.
The next question will be, can I still get the virus if I get the vaccine? You know, because there are a lot of questions that people still don't understand around the virus. If I get, around the vaccine rather, if I get the vaccine, does that mean I cannot get the virus again? Will the vaccine protect me from the virus? Can I still get the virus even if I have the vaccine?
Yeah. To answer that question, we need to look into the facts to say that what does the vaccine offers? Now, what the vaccine offers is, for the one I took, which is Oxford AstraZeneca, you know, offers almost about up to about 80% protection. It means that we have about 20% out there. By the time we take the second dose in May, by God's grace, it's going to increase our chances of protection also more. And that simply means not 100%. In as much as the vaccine is not 100% protection, then there are chances of somebody getting COVID-19
So the question will be, if I'm not protected 100%, why should I now take the vaccine?
Yeah, we will put it side by side to say if we have, we use our face masks, we use our hand sanitizer well effectively and well efficiently, and then we observe social distancing and obey the new law that we have now, and then we now add it together with what we have with the vaccine. I think that is good enough to actually protect the individual from actually getting COVID-19. And now we say that why should we take it? Yes, we should take it because that offer of 80% of 90% is massive. It's massive. 90% is massive. 95% is massive. Those are what we call really good chances and overweighs those chances of not getting it. So I think it's good for us to go for it, to get it. And I would say that, who knows, one or two things can actually happen, and then you just come out before you know it. But once you have that protection in, it actually gives you a lot of confidence to know that, okay, you can actually continue your work. And we reduce chances of lockdown, all those things. And then we also obey all those non-pharmaceutical methods. So somebody can actually have it based on the fact that we have about 20% and the rest. But I think it's really, really real. This is what we are talking about, 80 versus 20, about what we say 80, or we say 90 to 1. No. I think we can actually say that the chances of getting it, and that's why we use the word chance, probability. Yes, the chance of getting it is very, very, very minimal.
Okay,
very, very minimal.
Can a vaccinated person such as you transmit the virus? Those are questions that we need to ask. Can a vaccinated person still transmit the virus? For example, or, okay, let me put it this way, whether that is not the question to ask first.
Because
can someone, that has the vaccine first, can you still get COVID?
That's the question to ask, because the first question to ask is that, where would the COVID come in the first instance?
Yes, that's a question to ask you, since you're a vaccinated person.
Yes, because I'm a vaccinated person, it means that my mucosa is already armed with all this anti-COVID now, anti-SARS-CoV that is already there. It means that there is zero chance for COVID to actually get into my body in the first instance. To now, contemplate maybe transmissibility. But as I've said, those little chances are there, and how long this protects is another ball game, because we don't actually know for how long will this actually protect an individual. What we know is that it can protect for some time and can protect for a longer period. A booster dose is given, and that's why we have booster doses are going to be taken. For how long will it be? It's not there. So transmissibility is zero, and that is the key word in here. For vaccination to be rolled out, and we have people get vaccinated, it seems we are actually doing almost about 4 things altogether. One is for us to reduce, we are actually taking to zero, infectivity, meaning that infection is usually going to be zero. We are also limiting what we call transmissibility. It means the ability for you to transmit from one person to another person is minimal, meaning that if we have almost about 70% or 80% of everybody getting vaccinated, it means that
what we now call herd immunity.
Exactly, that's what we call herd immunity, which basically submit the total immunity in a community. The third one it does is that it actually reduces what we call the virulence and what we call clinical signs and symptoms. It means that you find really people in the street that are coming to go to the hospital that are going to fall sick. That is what we. And third and fourthly, it also helps to reduce what we call to barest minimum complicated cases. Because it's the complications that is very difficult to manage usually in our treatment centers.
So if I have the vaccine or when I get vaccinated, will it prevent me from having COVID? I'm asking these questions because I guess these are questions that people are asking or want to know about. If I get vaccinated, will it prevent me from having COVID? Just like you have been vaccinated, does it mean that you will not contract COVID?
Answer is yes.
Okay.
And I think I need to say that proudly, that Nigerians, if you are, you need to get vaccinated because it's going to stop you. It's going to stop COVID from getting to your body. Yes. And this is with the proviso that it is properly done and then you take, good precautions, We just said, by the time we take vaccines and then you are protected, like me now, I'm protected. By the time I take the booster dose, I know I'm protected, but you still need to be cautious.
Because I see when you were coming, your face mask was on. When we greeted, definitely we didn't greet normal in a normal way. We're still taking
precautions.
Precautions.
And we are sitting down, we are still maintaining social distancing. This is the way it should go. And with this summated effect, non-pharmacological and then the vaccine coming all together, I think this is going to stop COVID. And that's why you see worldwide, everybody is talking about just get this vaccine and all instrument of finance, that is money, capital, all these things is being brought into vaccination. Yes.
The other question will be, how effective is this COVID-19 vaccine against the new variants, perhaps that we have entered Nigeria? I know there are still studies being done, but for those of you that are into the field, what do you hear on a daily basis? Every
day we actually do a lot of webinar, we do a lot of talk with also our international partners, and to hear what is it like with them there after isolating that. When we look at the vaccine altogether, various level of various degrees of protection against the newer variants exist. And that has been shown in some of the literatures that we've read, and some of them that has been passed across to us, being that we are within the same international society in terms of those frontliners, in the world. And somehow we always look at it that, yes, various level of protection. The one I had actually also have a degree, a massive degree against the variant. But we know also there are various other types. We can talk about Pfizer, we can talk about Moderna, we can talk about the various, the J&J, the Johnson & Johnson. And with that, being equipped, they are equipped to actually take care of other variants like the South African variant, the UK variant, and all those ones. And I think it's one, we need to make it clear to Nigerians to hear, to know that even with the advent of variant, we always know that there is only one point where the variant usually takes place, and that is within the spikes protein. That is the spike protein. And that's why when we look at it from the literature, being an immunobiologist, I will talk about antigen shift and antigen drift, and then we now have new variants coming up with it. Now, if we have those, certainly, yes, some protection may not be, but certainly, yes, some can be. It all depends on what we call the mutation actually, and the changes that actually take place within those spike and the spike protein that actually are within the envelope of the virus. And this is something that we need to actually take seriously. But for us to say that, okay, for Moderna, for AstraZeneca that has been brought in, which also have an advantage for the fact that you can actually keep in a very good, favorable temperature, and we can distribute. I think that is a very big plus for us than taking what we know we will not be able to store, we will not be able to, no storage facility, and then we now brought in, and then you now inject what is not good. And this is why I have to assure Nigerians to say that the one that have been brought in, Oxford AstraZeneca, is good for what we have in ourselves and offers a lot of protection against SARS-CoV-2, including its variant. And we need to pass that message across to Nigerians.
What other message do you want to pass across, even as we end this discussion? Because at least we've spoken a lot about the vaccine. You being the second Nigerian that has taken it or that took it, you know, what myths do you want to, you know, talk against right here? Are there other things that you would like to tell Nigerians, perhaps those that are still having concerns and fears about this COVID vaccines, and also someone that is in the front line managing it? We still have people getting sick on a daily basis, isn't it, from this COVID-19?
Sure, yes.
So people still come to the treatment center on a daily basis?
Yeah, there are still people in the treatment center up to now.
So, okay, before you answer all that, have we seen the cases decreasing? People coming to their treatment center, what are the cases like? Compare and contrast for me, perhaps in the early days of COVID-19, perhaps April, May, to now, in terms of discharge cases. I know I see those data every day, but you are there, you're always in the room, you interact with these patients. So speak to me about that before you now talk about perhaps some other things you want to speak about.
I would say rightly that the cases have started declining.
Okay.
We have a decline in cases coming to the, to the treatment center, vis-a-vis decline in the number of positivity that's been, being given to us, being shown, that everybody see, and awesome job being done by Nigerian Center for Disease Control. Now, those data are real. The cases are falling, and also the cases that comes to the treatment center.
So is it that some people are getting COVID, but they are being treated at home?
Yeah, that if we look at that, that is true also. But we also will now look at it at the national outlook. In looking at the data that comes out every day, you will see that there has now been a decrease. Unlike when we are having, in this second week, we are having 1,000 to 1,000, breaking records of massive. But now it started coming down. Now, if some patients have been treated at home based on the fact that they didn't really, maybe they're asymptomatic, or they didn't really have that typical clinical signs and symptoms that will bring them to the treatment center. But within the treatment center itself, we have seen decline in the number of cases, of severe cases that comes into the treatment center.
Do you report more people that die from this virus in this treatment center compared to earlier on?
Yeah, in the earlier stage of the second wave, we actually had a spike in the number of deaths, and but it has reduced now, then, and that's one of those things I attributed that may be, the effect of what we call the new variants that were coming in. And as we are tough healthcare workers, and you have the best in the world, we have to study and look at it and sit down and think about what can we do to ameliorate these deaths. And I think that has really worked, and we've seen the number of deaths reduce drastically, and that will be. Now, coming to the question about where I want to tell Nigerians, I think I must have to start first to say that COVID is real. SARS-CoV-2 causing COVID disease is real. And
I want you to look into that camera and talk about it, Doctor.
SARS-CoV-2 is real, we need to accept that fact first for us to know that there are people that have died from SARS-CoV-2, that have died from COVID-19 complication. There are some people that are living today on they are living, but they still have complication of SARS-CoV-2. Some are living today, but they are still scared of a lot of things they do before based on what SARS-CoV-2, that is COVID-19. So there are a lot of people based on different strata at which they find themselves having contacted COVID-19. So it's real. And we need to pass message across to the whole world, to our people, to the whole world, and go to our world, go to our people and tell them this is real and we need to be very, very careful. And the second thing I need to pass across is to say the vaccine is good. The vaccine can be, you should take the vaccine, and the vaccine will not cause any. I've taken the vaccine and I'm here talking, and I've took my food, do a lot of things, and today I'm even fasting, you know, as part of my Monday fasting, part of my obligation of what I felt, you know, fasting, and I'm still fine, I'm good, and I'm good going. So it's safe, it's good, and we should take the vaccine. When it comes knocking at our door, please, let's take it. And the enthusiasm should be there for us to take this vaccine, to encourage the government and the donor partners that have worked together to bring this vaccine to us. And number 3 is for me to say that let's keep on fighting for the frontliners that are there, that are working. I know by God's grace that your effort will not be in vain, that everybody is watching, and by God's grace, the reward that we have when the patient gets discharged and he says, thank you for what you have done. Thank you. You are a fantastic team. You people did very well. I think that is massive, and the prayers they give to us. But we also want support for things to be given, at least so that people can come out and say, this is what I was given. This is what was in my name for those courageous period that I fought COVID, that I helped to save the country, the state, and all those things. And I think this is something that I think I need to say to the government about that. And thank you very much for all the support that you've given to all the frontliners. Thank you.
I think that's a beautiful way to end the show today. I also want to say thank you to our health workers. Thank you to you, Professor Yunusa, because I know...
We need to give them a round of applause.
Yes, a round of applause.
All our healthcare workers. So fantastic.
To all our healthcare workers.
Fantastic nurses, doctors,
fantastic
and great
people.
Work, yes.
Even with the meager resources. I was part of those people that talked about... I don't want to go into all of that now, your hazard allowance and all of that. I know how much we talked earlier on. But I just hope that we're learning the lessons from COVID and take this crisis as an opportunity. So thank you very much, Professor Thairu, for joining us. You've heard him. I don't have any other thing to say than be the best you can be the change you want to see. Don't forget, he said it, COVID-19 is real. Wear a mask. I'll see you again. Bye now.